Services Directorate of the University of Ghana has cautioned the university community of a recent resurgence of COVID-19 cases. Well, yeah, that's exactly what's happening. With a few suspected and confirmed cases reported in the university immediate vicinity. Now, we're going to put portions of the statement on the screen right now. It says the Health Services Directorate would like to inform the university community of a recent resurgence of COVID with these few suspected cases. It goes on to say that in the light of this development, all staff, students, and visitors are strongly advised to remain vigilant and strictly adhere to the following recommendations or recommended preventive measures to reduce the risk of infection and community spread. 1. Wear face masks properly, especially in enclosed or crowded spaces. Wash hands frequently with soap under running water or use alcohol-based hand sanitizers. Maintain physical distance of at least 1 meter where possible and avoid large gatherings unless absolutely necessary. Ensure good ventilation in offices, lecture halls, and meeting rooms. And stay at home if you experience any flu-like symptoms and seek prompt medical attention. So we got back to the university campus, and one of our colleagues there, an intern with us here at TV3, Eric Biadela, who interacted with some of the students, his colleagues at the University of Ghana, about this news this evening, and this is what they had to share with him. Take a look.
I heard it from TikTok, but I've not been following it, but I know of it.
Yeah, I also haven't been actively following, but then I've heard it's coming back. Yeah.
So I would like to know then, have you been vaccinated?
Yes, I have.
No, I haven't.
So how prepared do you think you are for an outbreak personally?
I'm not ready for an outbreak.
I'm not prepared at all.
Okay, so if there was to be an outbreak and the university were to move back to what they did, very strict protocols, online classes, how do you think you'd be adapting to that? How well do you think you'd fare?
I'll be so pissed.
It's going to be very difficult. I mean, nah.
It shouldn't come back again. That period was stressful.
And the online classes and all of that, nah.
It's not effective.
Okay, currently no, it's past, so I just dump it in the past. Which means you are not aware of any resurgence or any noted resurgence that the university has communicated.
No.
Okay, so have you been vaccinated?
Yes, when it came at first, I was, but I don't think I will again because I heard it's diabolic.
So why were you vaccinated in the first place?
I didn't know anything about it, and then it was like, if you don't get vaccinated, you cannot travel. You don't get vaccinated, you need green card or you look or something, blah blah, a whole lot of it. So you just cleared all those kind of things when traveling or doing anything. I just had to get a vaccination. I think in my school it was compulsory, so they forced us to get a vaccination. So that was how I got with the first dose. But second, so I said, well, I will not do it.
So in the event of an outbreak, how prepared do you think you are?
First of all, I didn't expect an outbreak again because Pastor Chris told us COVID-19 is gone and it's not coming back. So
Well, so is that last point? This is a student, and our colleague Eric Biadela speaking to his colleagues. He's still a student at the University of Ghana, speaking to his colleague students at the University of Ghana, Legon. And the last point that the gentleman made, that's a student saying he had a pastor say that COVID is gone, it's not coming back again, So if there's going to be any resurgence at all, he's not heard of it. He doesn't even want to hear of it. But the university has just put out this notice and urging the community, including the students, to adhere to these protocols. And Professor Joseph Humphrey Bonney is an associate professor, head of Department of Virology at the Noguchi Memorial Institute for Medical Research at the University of Ghana, Legon. Appreciate your time, Prof. I know you got some few minutes to spend with us. But how did this news of COVID cases being confirmed at the university strike you at Noguchi?
Yeah, thank you very much for the opportunity. Well, I would like to say, unfortunately or fortunately for us, in the Department of Virology, University of, Noguchi Memorial Institute for Medical Research. We are mainly the outfit that are testing for these clinical specimens that are suspected for these respiratory infections, and we are confirming it. So we know about it already. So it did not come as a surprise or a shock. Maybe we were just waiting for the people in the university environs to be giving that caution for us to go back to the protocols that we used to use, mainly when we were at the height of the pandemic, that is the COVID-19 pandemic. So it was not a surprise to me because we have been seeing this increasing numbers from April. It was not overwhelming from then. We were just having isolated cases and going up a little. So recently, when one of the halls had, I think, a whole week, and we had a number of suspected cases coming in, quite a number. And after the testing, we realized that almost half of the number that came in as suspected were confirmed to be COVID-19 samples. In other words, SARS-CoV-2 positive.
I see. So you started monitoring these cases as far back as April at Noguchi. So it's just fair to say that, well, the COVID-19 never really left us. The virus was probably, in your view, from where you sit, suppressed, at least for over the last 2 years, is it not?
I don't think it was announced anywhere that COVID left us. It's a respiratory infection and we can get it anytime. Just that the numbers decreased drastically. But Noguchi has been doing this sentinel surveillance activities for respiratory infections. So we have areas that we pick people who show these symptoms and we test whether they are influenza or anything other than influenza, which is respiratory. And like I said, over some few months now, we have been seeing isolated cases of SARS-CoV-2 coming in. Then all of a sudden we had this spike. So, like I was saying, it's not new. COVID never left us. Numbers went down drastically, but now they are picking up. Fortunately for us, when we do the testing, we go beyond the normal qualitative testing to know whether it is positive or negative, to do the sequencing, to know what kind of strain is also circulating. And we know that we have Omicron, and Omicron, we have so many subvariants. These Omicron, they are highly transmissible, but less severe. So we're not surprised to see that spike all of a sudden with the numbers we had recently.
And I do appreciate your thoughts on this and a bit more detail on this matter as well, and caution to the students out there to adhere to the protocols.